All right, so going back into my client record, and I want to go to contact and location. So I'm going to start with contact. So up at the very top, that's about 4 tabs over, and I want to add a contact. Very easy. You click on the add button, add contact to the right. You will see contact type, and it doesn't, it appears there's a drop down, but there is nothing added here. The reason why is contact and location used to all live in one tab, and so there were some varying things before, so the vendor had to put it in this way, but there is no other option. We want to put in the phone number, and I did not have an email, but if I got an email, let's say, I can put in and then I have that this is an active contact. And then we have this toggle that says private. So earlier this morning when we talked about privacy settings and how we can make various things throughout the HMIS private, this is one of those times where we could make a contact phone number and email private. So only the agency that's creating it would be able to view it. To any other staff person in any other agency, if we make this private, it will not exist to anyone else. To show you how it'll look, I'm going to select private for now. I'm going to select today's date, and then we have a note section. So where this is important, think of your notes as instructions. So if this is a phone number and email for a client, maybe this is only a message. So you can say, for example, message phone only, please only leave your name and number. And so this would be just instructions that someone else would need, or in case you had forgotten what the instructions were, this would be your reference as well. When you're all done, you're going to hit Save Changes. And if I click back on the contact, that'll take me back to that home screen on the contact tab. And now you'll see here I have my contact. And what you can see in here is this is the client name, here's their phone number, here's their email, the date it was added, and what you can see here is there's a padlock. So that means that if right now I'm in my training agency, if I switched over to another agency, then this would disappear. And then I have the little dialog box here, so it will give me the note within this. I can also edit this by clicking on the edit button to the left. And let's say it's now okay to share this. I could untoggle the private, hit Save Changes, and when I go back to contact, the padlock is gone, nothing else has changed. Now let's say that this information is now bad and it's no longer active. We don't want to delete it. What we want to do is we want to untoggle active contact, hit Save Changes. When I go back to contacts, it doesn't show up here, but there is a thing that says show inactive contacts. And so I can click on this, and then the contact comes back. And let's say that this information is now valid again. It's really easy to move it back to being active. I click on the edit button and toggle back on active contact and hit Save Changes. And you'll see it's back. Next I want to show you is location. So location, we have 2 different types. We have hard addresses we can enter in, or field interactions. So to kind of give you an idea of both, right now what we have is we don't have any locations recorded. The map does give us various options. We can expand the map out to, currently it's on imagery. We can do imagery hybrid. It may just take a second. We can do streets. And essentially what we're getting is the bubble that's showing up on the map is it would be your agency's main office. So for folks that are working out in the field, if you on your electronic device, whether you're using your smartphone or your or your tablet, you can do a field interaction, and you want to be sure that the GPS settings are turned on. And so what you'll do for that is right here, you're going to see this little arrow. You want to, you'll see it says for the most accurate geolocation using the locate button on a mobile device with GPS technology is recommended. When I click on this arrow, a little pop-up will show up, and it's going to give me an address. It doesn't give me the option to cancel. It only gives me the okay. What we have found is occasionally the address is a bit wonky. So what you would need to do is hit okay. If it's a bad address, so here you can see here's the address. It will say the staff person that did it. It was a field interaction at this time. If this address was bad, meaning we consider a good address is if it's within 100 yards, then you will hit delete if you don't like it. It's going to ask, are you sure? And then what you can do is you can add it again. And if what we have found is typically if you get one bad address, when you do it a second time, it'll reset and you'll get a better address. And so then if we like it, we leave it alone and we can move on. To add an address, what we would do is we click on the plus sign. And then for address type, we have multiple things in here. We even have last permanent address, so we can record that here. We can also home, work, school, mailing address, encampment. So let's say it's an encampment. It also will ask us to name it. So we can keep the name the same or change it to something different. We could use, for example, intersections. So if I want to say Howe Avenue and Arden Way, be sure to put in the state and the zip code to the best of your knowledge. It's going to, for today's date, again, this will be an active location. This works just like the contacts. Same with private. For notes, again, this could be instructions. Maybe what we want to say is tent is behind the open lot. This is, again, we want to give folks instructions so they know where to go if they're looking for this person. Maybe they have dogs and you want to be aware. You can say client has 2 large dogs. Again, this is all about instructions, so we're keeping everybody safe and able to locate folks. When we're all done, hit Save Changes. And I'm going to go back to my location tab, just like I did with the contact. And what we'll now have is here is that bubble where we typed it in. So if we scroll in, we should see that this is pretty close to Howe and Arden. Let me go to streets so we can verify that. Here's Howe Avenue and here's Arden. So it got fairly close. If we wanted to edit this one, what we might want to do is, if we know what this one of the street addresses is here, we can put in that address. But you'll see here is the address, here is the staff person that did it, here is what was named and the date. And if I wanted to make any one, this one I can only delete, this one I can edit. And right now it's showing active. If I want to turn something to inactive, again, all I need to do is turn off the active location, hit Save Changes, Go back to the location tab. The bubble has now gone because the system is going to default to only showing us active addresses. But if I want to see inactive, I can hit search. And it's giving me the inactive one, or I can ask to see all. Or I can say I only want to see addresses. And when we say addresses, we're really talking about when we do the entering the hard address. Or if I want to see just field interactions. So again, where this is important is if we don't have phone numbers and emails and we need to physically go out to where someone has been staying so we can let them know of a housing opportunity. This information is also used for the point in time count for writing up maps when we do that. The point in time count in January, so we know where to send surveyors out to. All this information is very important for that. So we want to review the notes tab next, which we can add client notes and we can also add public alerts. So what I'm going to give you the sample on the client note today is we're going to pretend that we did the verbal consent. So going back to my client, and just to the right of location is notes. And to add a new note, it's very easy. You'll see client notes here, add a client note. When you title things, it should always be short, sweet, and simple. If we're doing long paragraphs here, it'll be very cumbersome for someone to figure out what's going on very quickly. Save more of your detail for the body of the note. So I'm going to say verbal consent obtained, and time tracking. This will give you hours and minutes. This is how it looks. Where this could be helpful is if you wanted to write a note that you were looking for their encampment or something and it took you 20 minutes, or I don't know, this could be anything where if you want to put in the time that was associated with your note, you can. Otherwise, with this particular note, if I just want to say, hey, I obtained verbal consent, say I reviewed really quick note, I just said I reviewed the HMIS consent form and the client agreed to have their information entered and shared in HMIS. Verbal consent was obtained to maintain safe social distancing. Once I'm all done with my note, I have the option of making it private. Again, if I make this private, only folks from my agency will be able to see it, and then I can hit Save Changes. If I click back up here on the Notes tab, now you'll see my note. You cannot see the body of my note unless you go into it. So again, here's the title, here's the agency it was created by, here's the staff name, and here's the date. I can click on the Edit button, and then here's my note. The other thing we have here are public alerts. What we use public alerts for in our systems is if the coordinated entry departments are trying to reach somebody for a housing referral and we don't have current information or current locations to find them, we may put out a public alert to let folks know in case they come across this client that, hey, coordinated entry is trying to reach them because they have a potential housing referral. Other times we use public alerts is for health and safety risks. So for example, maybe we're using this because we were meeting with our client and they were suffering from their mental health symptoms and were expressing suicidal ideation, and then they disappeared on us. So maybe we write a public alert saying, hey, this person has not been in contact with us, and the last time we seen them, they were unstable and expressing suicidal ideation. Please, if you get a hold of them, have them contact me. Those are times that we would use public alerts. And so what we're going to do to create a public alert, we're going to click Add Alert, and I'm just going to say Health and Safety. So again, this is supposed to be short, sweet, and simple. Here's the agency that's creating it. And then there's an expiration date. The expiration date is not about the note expiring, but what the alert generates. So it is going to generate a alert bar on the client record, and I'll show you what that looks like after we're done. Expirations should be no greater than 90 days because we don't want to keep public alerts on people's records for very long. And if at any point you created a public alert and now it's no longer valid, like maybe they end up coming back and everything's fine, then you want to remove or change the exit date or the expiration date. So that way the banner comes off the client record, and I'll show you what that looks like. So I'm going to have the expiration date be tomorrow. And your notes again is about instructions of when someone comes across the client, you want them to, this is about giving them instructions of what they need to do if they come in contact with the client. Scroll down, you do have the ability to make public alerts private. I'll explain in a moment when we would do that, but for right now I'm going to hit Save Changes. And when I go back to Notes, here's my original note, and now here's my public alert. Now what this does is when I go to my profile page, when I click on here, you're now going to have this yellow banner that says Public Alert. This client has been issued a system-wide alert. Please review the notes for full details. When we do public alerts, this does not send out emails to everybody in HMIS. It doesn't send out phone calls. The only thing it does, it puts the banner on the client record. So in order for someone to know that there is a public alert for a client, they have to actually go to the client record. So that's really what it's about, is just if someone so happens to come in contact with them, they open the HMIS record, they see this alert, then there is instructions. To get to that particular note, so if we say, hey, here's a public alert, what's going on? What do I need to know? If you click on this little arrow, it's kind of hard to see. It's red when my mouse is not there. When I click on it, it'll take me directly to my public alert, and it'll give and then again, ideally you should have your instructions on what you need to do if you're in contact with this client. Times we make it private. Where this would be appropriate to make a public alert private is when the alert only applies to your agency. So for example, if you are a provider that is running a shelter and maybe your client doesn't get along with a staff member at that shelter or another client at that shelter, it may be appropriate to write a public alert saying that these people need to be kept separated. And that would be a time that you can write a public alert, but make it private because it would only apply to your agency and your shelter. If I wanted to change my expiration date so I can take it off, I'm going to put it on yesterday's date and hit Save Changes. And now when I go to the client profile, you'll see that that banner is gone. So the next thing I want to show you briefly is client files. And so what we have under the client files, this is where we have client provided documentation or the homelessness certification documentation that Sacramento County COC needs. When we are uploading files, we only want to modify a file to correct it, and we only want to delete files that we know do not belong to the client, the household, or do not belong in HMIS at all. So for example, I came across a few months ago, we had a staff person upload a client's debit card. Debit cards have no business being an HMIS, so it was something we removed. Mental health assessments and physical health assessments do not belong in HMIS. HMIS is the Homeless Information Management System. It is not a medical record. When we're adding or uploading files, we have categories and names that are drop down, and I'll show you those. And essentially what you would need to do to upload a file is you would need to save that file on your computer first. And we do have the option of adding files and making them private, so only your agency can see it. And then for forms, again, what we have on there is the VI SPDAT consent form and revoking consent. So going back into HMIS, I'm on my adult client, and what you'll see here is files. So I've clicked on that, and this is where we can add files. So to add a file, it's very easy. You hit the plus sign. You want to select your category, and what you'll see is we have quite a few categories to choose from. You can select, for example, identification documents, and then we have plenty of predefined names. So again, please review these before you select other. What other does is it gives you a text field to type in things, which is great if we don't have it. But what I can tell you is we have lots of different things in here. And when we stick with the predefined names, it is much easier for us to run system-wide reports. If going back into identification documents, if I wanted to say that I was uploading their driver's license or ID, again, this is something I would have needed to scan and put in my computer. I would then select my file. It'll take me to my file explorer. I select the file and hit open, and then I can make that record private. Again, this is where it would only exist to my agency and not to any other agency, and I would hit save changes. So when I'm in here and I go to files, here's how it'll appear. This little double box means that this is attached to various other projects or program enrollments because they need this document for their program. So you can, within a program enrollment, link to these documents so that way your program has the documents it needs for eligibility or audit purposes. So for history, and I'm staying on my Lindsay test client so I can show you some things. This is a client that we do a lot of testing on. So I want to let you know that what you see in here is not typically what's possible in any one ZOC. But if I go to the history, which is just to the right of programs, I now have a history of program enrollments, services provided, referrals, reservations, which is part of services, and assessments, which would be anything on the assessment tab. So this is any history that's all kind of smushed together, no matter what agency provided it. You'll get the full list in chronological order here. So these are color coded. So greens are assessments or the surveys, blues are referrals, whites are services, and yellows are program enrollments, and pink is a reservation. This is again around services. So we don't see too many of those. To kind of give you some information of what we're seeing here on this page, you'll see if it's a referral and it's blue, it'll tell you referral. Here's a community queue one. Here's the date that it was sent to the community queue. Here was the date that it ended. So if you're Yolo County folks, if you were only seeing this, then you'd be like, oh, they don't have a community queue referral. Then the next thing is looking at, do they have a housing referral? So for example, if they have a referral that's pending, then we don't need to send them back to the community queue. Other things on here to show you is this little box, the little double box. That means this is a service that is connected to this program enrollment. This is a survey that was connected to this program. $sign here, this is the amount that was recorded for this service. So this was a rental assistance. and the expense amount was 1,400. Sometimes what we'll see is a little dialog box with notes. I'm not sure if I have any of those ones here. Here we do. Here's one, and again, when we put our mouse on the little dialog box, the note will appear to the right, so we don't have to go into it. We do have over 3 pages of history for this client record. This right here, this little chain link, this is a program enrollment that was a result of a referral to that program. The last thing I want to show you on here is if you wanted to look at something specific like just services or just referrals, we can do that by going to the advanced search options. So when I click on this little view drop-down arrow, these are all the parameters that I can filter out some of this information. So for example, if I only wanted to see category, this is service categories. So let's say I only want to see services around case management. I can also select the type: assessments, programs, referrals, services, or reservation. So I'm going to select services. And for me, I don't care from what agency, and I'm not giving it a predefined date range. So when I hit search, it will filter out everything except for the services, and I reset my thing. I wanted case management. So now here's all the case management services that this person received. So again, keeping back on the global taskbar, we do have services available here. The services here should be services that are for things that we're providing to clients outside of a program enrollment. What that means is maybe you've encountered them in the community, or maybe they've come to your office and you're providing them a service but not enrolling them in your program, then this is where you would provide services. So typically what we should see when I click on services, and again, I'm in my training agency and there's some things to update, we would not see housing services or rental assistance here. These are errors, but maybe we have something like building trust and rapport or providing them food. It might be something that we would provide outside of a program enrollment. What you find here will be a much shorter list than the services you can provide within your program. So the next thing I want to show you is the Programs tab. So when I click on Programs, what you're going to see at the very top, this is the program history. So this is all the programs that this client has been enrolled in. Here's the name of the program. This is the agency that owns the program. Here is their start date. Here's the end date, and if it says active, it means they're currently enrolled in that program. And then for type, we have 2 types. We either have individual or we have group. Individual is just that. Group means that there are multiple people enrolled in that program enrollment together. This little chain symbol right here, this is a program enrollment that was connected to a referral that was sent to it. This is a private program enrollment, so where you see this padlock. And if we scroll all the way down, then we have programs available. Again, when we get down to here, this will vary depending on your agency. And again, just like on the assessment, this is the menu of programs that your agency offers, not necessarily all the programs that this person qualifies for or is eligible for or should even be in. This is just your menu. So when we want to enroll folks, we'll go down here to enroll them. But right now I want to show you some things that are inside the program enrollments, and then we'll take our lunch. So to go into a program enrollment, what we want to do is click on the edit button next to it. When you're in your own agencies, if you see programs like, for example, the City of West Sacramento, you will not have an edit button for that. You'll have what looks like an eyeball so you can view it, but you won't be able to edit it. You can only edit program enrollments if it's part of your agency and you are in it. So again, this kind of going back to if you are for example, a WIND youth provider and you're a staff person that works with the Wind Youth projects, but also with the TLCS projects that you partner with, then you'll need to swap agencies so you can make edits or provide services or assessments within those programs. And then if we want to go in the programs, the section on this one, we would click on the edit button. Once we're inside the program enrollment, again, you'll see here's the client name, here's the tab, then here is the name of the program that we're now working in. And once you're in here, what you'll see is when you go into an existing program enrollment, it'll always default to taking you to the history for that program. And so what you'll see here is services that have been provided. These are referrals that were sent from the agency. Then we have the program enrollment screen. So we will be doing a program enrollment. And so when we click on enrollment, you'll see how all the questions, these are all the questions on an enrollment screen, and this is what was answered at the time of enrollment. It's going to take us back to history as always our starting point. We also have provide services, assessments, notes, files, forms, and exit. Enrollment, assessments, and exit are all going to take us to screens where they all nearly mirror each other. We are asking specific data elements like disabling conditions and barriers. We're asking information about income, non-cash benefits, health insurance, education, and employment. These are all meant to be benchmark data that we are recording over time and how they change. Providing services, when I click on here, again, this is going to be taking us to our menu, and these are all the services that in this program that this agency says is able to offer within this program enrollment. When we go to assessments, we can see them in two spots. Here is our menu at the top. That's why it says start. And then here's our history of what was conducted. Then we have notes. These are notes that you can put in specific to your program. And it works just like on the global taskbar. You just click add note. Then we have files. And from file, we can either add a file just like we did up here on the global taskbar, or we can link from files. And when we link from files, what this will do is we click on here, it shows us all of the files that were in the global. And if we want to link them in, we just toggle it on and hit link and close. And then lastly, when we exit somebody, we want to complete the exit screen, which is found here. And so again, it is going to look very similar to the program enrollment screen, except for we're going to ask some information about where they exited to. On the right-hand side of the screen, what I want to show you is this little box here. The 403 this is how many days they're active in the program. So from this start date, it's been 403 days. If this was a closed or ended program enrollment, this number will change and the box color will be red, and then it'll be how many days since they exited. This also tells you the program type, so they're enrolled in this program by themselves. This is the assigned staff person, and if I needed to change this or wanted to change it, there's an edit button here. And I would have a drop-down menu for any available staff in this training agency to switch them to. I can also make the program enrollment private by toggling this on and hit Save Changes. And what we should see is a little padlock show up, which is being a little slow. There's our padlock. And then for every program enrollment, just like the global household, we have to identify a head of household. If someone is enrolled in a program with other global household members, you'll see those people listed here.